I just feel like I
Mm.
learned so much right now because I thought like, oh, your heart just does its heart attack thing and then you're, on the ground or I didn't realize that there's yeah, like you could have awareness through that. And maybe someone listening has gone through that before or didn't know that either. Right. And I just think, yeah, that's super interesting, right? You're not just
Mm.
attack and then done. It's like there's
Yeah,
some things to maybe notice or pay attention to, or like you said, those voices are just an inner knowing of like, wait, I need to get checked out.
absolutely. And I definitely want to echo or bold, underline that women have different symptomatic responses during a heart attack than men. And we've probably heard or been informed that, right? Maybe left arm tingling and chest pain is a typical sign of a heart attack, which it is. But in women, it may present very differently. It may be chest pain that's coming and going. It may be a shortness of breath. It may be all of a sudden, maybe a few days of extreme onset of tiredness. And so I definitely encourage people, because unfortunately you won't know until you know,
And you
to
know
try
what?
and really check in with yourself, right?
Yeah.
How are you physically feeling? How are
What are the levels called again? Sorry, I didn't mean to interrupt you. You said the what's the T word?
a troponin?
Troponin, right? So you're not just going to like feel off and want to go run and get your troponin levels checked all the time, right? It's like,
Right,
how do you
right.
know when it's time to, especially as a woman, like you said,
Yeah.
yeah, the symptoms are different than what you would expect. Or like being tired, I would never think, oh, and not that we want people to think big things out of something that's not that big, but like, I would never have known that. Never.
Mm-hmm. And it's also so important, and not to even stretch it as far as hypochondriac. In your journal, whether you journal or just make a note, if you notice just feeling weird one day, just write it down. It may be nothing, right? It may just be stress from work or, where you're at in your menstrual cycle or whatever it is, but just make a note. If you feel like something's weird or just write it down. Because once I was in there, once we figured out the diagnosis of having a minor heart attack, I had acute pericarditis, which is where the swelling of the lining around my heart filled with fluid. And I was obviously cycling really hard, and my heart couldn't keep up with the demand.